This segment of the Safe Injection Practices Review addresses the importance of verifying the medication, or in this case, the vaccine, that is to be administered to your patient. When preparing for immunization, you must always verify which vaccine or vaccines are needed. Many vaccines look alike, and some have names that are very similar, so always check to make sure you are preparing the correct one. This is also the opportune moment to make sure you are familiar with the vaccine, as you will need this information to talk with your patient about allergies or contraindications to the vaccine. It is also important to provide education about vaccination, the vaccine you are about to administer, and the disease or diseases targeted by the vaccine. Rely upon the information provided by the manufacturer, commonly called the prescribing information, or what we usually call the package insert. This material reviews the vaccine and provides important information that you must review prior to administration. Also, rely upon high-quality resources, such as the CDC's Pink Book. This book describes the vaccine, the diseases they are seeking to prevent, the spacing of vaccines, information about vaccine components, and many other useful pieces of information. The book is full of useful tools and resources important for use in all settings where vaccines are administered. In addition, consult the immunization schedules that are regularly updated and published each year by the Centers for Disease Control's Advisory Committee on Immunization Practice, or ACIP. These immunization schedules are color-coded and annotated with information about the vaccine and ideal timing and spacing for administration. Use of the immunization schedule can help with verification of the vaccine and timing of doses, which are important elements of safe practice. Now let's talk about our take-home points. First, the need to know your medication or vaccine so you can make sure you are preparing the correct one for your patient. You should always have some resources readily available that can help you with questions regarding particular vaccines or their components. Such resources include the CDC Pink Book, or one of my favorite websites, immunize.org. This website has great resources such as education for healthcare workers, checklists, patient education materials, standing orders, and information about vaccine components. There are also some great frequently asked questions. Another one of my favorite websites is the National Foundation for Infectious Diseases, or nfid.org. This website has regular webinars for healthcare professionals, including updates that preview changes to the immunization schedules. Lastly, vaccines and the adult and child immunization schedules are becoming increasingly complicated, so always stop and verify before you prepare to vaccinate. Make sure your work is protecting your patient from error. Thanks for your attention during this segment of Safe Injection Practices. I hope that you'll take the time to look at the next segment.